Welcome back to Autism Live. I'm Shannon Penrod, and I'm here at the Center for Autism and Related Disorders with Dr. Jonathan Tarbox. So thrilling to have you here today. And you have this inspirational story that you want to share with us.
Sure. So yeah, I was reading the newspaper this morning, and this isn't related to autism directly, but sometimes I think it's good to sort of connect to the broader community of folks with challenges. So yeah, I read this in the newspaper this morning. 3 climbers, Craig DeMartino, Pete Davis, and Jerem Fry, just completed the first all-disabled ascent of El Capitan in Yosemite. This was yesterday, June 14th, 2012. El Capitan is one of those sort of lifelong dream ascents that pretty much anyone who's a serious climber, that's on their bucket list. It's something they want to tick off before they're dead. And these guys did it. All 3 of them on this team have some kind of very significant physical disability. All 3 of them are missing either an entire or a partial limb. It took them 5 days and 4 nights. They were actually sleeping in these things called portaledges, which are basically like a cot that hangs from the wall. 5 days and 4 nights to do the climb, which is actually pretty average, maybe a little bit slower than average, but actually not very, very bad. The climb was almost 2,000 feet high, and so they're spending, 4 days, 5 nights, 5 days, 4 nights rather. And it's just sort of inspirational that they were able to do this thing that, if you or I, under the best possible circumstances, decided to spend the next 10 years training for this, we might not be able to do it. And these folks who, have these real significant challenges were able to achieve it. So it's just kind of inspirational.
Very inspirational. I think anytime somebody overcomes, I think we can all celebrate in that. And as a parent, my thing, I want to know where their moms are, what they're thinking, Well, and
I was thinking it's kind of a good metaphor for parents of kids on the spectrum. Is sort of like here. Let me just read a quote that that one of these guys said. He said, So actually, let me give you a little more background.
Okay.
One of these guys had part of his right leg amputated after he had taken a 100-foot fall years ago. So they had to remove part of his leg.
Wow.
And his body was shattered, but he got back together, did his rehab, and got back into doing what he loved. Another guy, one of the other guys, lost his leg to cancer at a young age, and another guy was born missing part of his arm, and so he only climbs with one arm.
Wow.
Again, stuff that any really good climber wishes they could do some point in their life. These guys are just doing.
Wow.
Here's a quote. "I never really felt like my shattered body was a reason to stop doing what I love," he said. "Everyone is disabled by their excuses for why they can't do something, and that grounds them from doing the really great things they could do. But when we're out there trying, great things get accomplished."
Wow.
Isn't that a good metaphor for just day-to-day surviving and commitment?
Absolutely.
Because it seems like that's one thing I hear all the time from parents is just this overwhelming fear, anxiety, depression, and at the end of the day, the only thing you really can do is get back in there, get back in the fight, and do your best.
Yeah, I had friends visiting the last 2 days, and the one friend was saying, how did you make it through this journey? And I said, honestly, what I saw in other parents was that they made a decision. Well, we're just going to do everything. That there isn't a win or a lose on this journey. We're just going to do everything that we can and fight every individual day to gain as much ground as we can. There is no option of failure. There is no option of quitting. It's just that decision. And I said, if I could do that with everything else in my life, what could I accomplish?
Yeah, it's really
but
true.
There was no possibility of, okay, well, we've tried that enough. We're done. It was just, what are we going to accomplish today? And I always like to think of the metaphor that somebody had shared with me, because I am not a mountain climber. I believe you do that I won't be doing that. That's not even on the list at all. But the idea that when you go to climb a mountain and you stand at the base of the mountain and look up, it looks impossible.
Yeah, and that's true. It really does.
But that when you start to climb up, and for most of us, when we walk up a mountain, not fixing anything and climbing up it, but when we walk up a mountain and you start to walk, and maybe it's not a direct route, but you start to walk, you no longer can see the top. You're just focusing on what's in front of you.
That's right.
And you find yourself making progress.
That's right, and that's a great metaphor for any major challenge in life. I mean, if when you go to college, if you think, how am I going to get the next 4 years done? Forget it. You're gonna fail the first day. It's always about just taking off a reasonable bite that you can chew on, and you know, doing a reasonable amount, doing one foot in front of the other, basically, one day at a time, as folks say.
Or as you like to say, how do you eat an elephant?
One bite at a time.
There we go. Exactly. Well, kudos to these people. Truly inspirational. Thank you for sharing that with us, because I love that. When we're out there trying, great things get accomplished.
Yeah, it's pretty good, huh?
It's
and you
amazing.
know, it kind of reminds us of just a common sense ABA thing, which is one of my favorite things that I've learned from ABA is you can worry about things all you want, you can think about it all you want, you can plan about it all you want, you can have any emotions that you want, good, bad, negative, positive, otherwise. But at the end of the day, what really matters is do the behavior.
Yeah.
Just get out there, do the behavior. You know, do the thing.
Amazing.
Identify the thing that matters to you, that you value, that matters to you and your family, and just do it.
Yeah, absolutely, absolutely. Well, you brought up worrying in that sentence, and that's sort of my next thing that I wanted to talk to you about. We went to, you were there, I was there at the ABAI conference, and there was so much happening there.
Yeah.
It was amazing,
really
the amount of knowledge, thousands of presentations, and you know, you just wanted to, I certainly wanted to divide into 1,000 people and go and see all of them, and felt like I'm missing so much. It was bigger than Disneyland in that respect. You know how you just think, you know, we have a goal, we're going to get this much done at Disneyland, and you can never do it all, but it was that on steroids. And but one of the things that really, that, you know, because then you come home and you think, okay, what did I learn and what was exciting after the fact? And there was a lot of discussion I found, and maybe it was just what my ear was attuned to, about anxiety. And there was one particular presentation that I went to where 4 different people spoke about anxiety, and what really, you know, I'm not a numbers person, I'm not a statistics person, but it was somewhere in the neighborhood of about 30% higher rate of children on the spectrum having anxiety issues, whether it was a full-on anxiety disorder or just issues with anxiety. And that was kind of stunning to me in one of those ways where I wasn't overly surprised by it, but it just kind of made
me hit home.
Yeah. And so it was one of the things that I wanted to talk to you about, anxiety. And I know a lot of people want to medicate their kids, and we've talked about this a little bit before, about what's the research say about medication and anxiety in kids with an autism spectrum diagnosis.
Well, and you know, for full disclosure, I should first say anxiety is not my area of expertise necessarily, but from what I am aware of, there's very little research. Actually, unfortunately, there's not a lot of research on treating anxiety in children with ASDs, period. But there's very, very little research, maybe zero, supporting the use of medication for children.
Not that there's none at all, but very little supporting it.
Yeah, and so it's not to say it doesn't work, it's just to say there hasn't been very much research done on it. So I'm not saying it doesn't work. I've heard many clinical reports and talked to many colleagues who've said it's made a huge difference, and many parents, frankly, have said their child on the spectrum was suffering from anxiety, and some sort of SSRI or other medication was helpful. So it's entirely possible that it works. But you know, my job as a scientist here is to point out where there is and isn't research. And as far as I'm aware, there isn't a lot of research on that topic. However, there isn't a lot of research on other forms of treatment for anxiety either, so that's something to consider. But what we do in applied behavior analysis is very frequently has beneficial effects on anxiety, because a lot of what we do anyways, and a lot of what's sort of common sense from an ABA perspective, is actually what would be recommended by research on anxiety treatment in other populations. So for example, a major thing is exposure to feared stimuli and feared situations. In ABA, what we do is gradually expose kids to stuff they don't want to do, right? And whether it's new social situations, whether it's completing academic tasks, whether it's self-care tasks that involve scary stimuli, you know, could even be sort of sensory things that the kids are afraid of, maybe having sand on their hands at the beach, maybe it's, you know, soap on their hands when they're washing their hands. What we do anyways in ABA is gradual exposure to whatever the problematic situation is, piling on tons of positive reinforcement, teaching appropriate coping strategies and alternative behaviors, and then reinforcing the heck out of those behaviors. So what you're doing is pairing positive reinforcement with a feared situation. And so what we do find is a lot of feared situations become neutral and sometimes even preferred after we do what we would kind of just normally do anyways in ABA.
Yeah.
As long as you're taking a real positive and gradual and positive reinforcement-based approach, not just purely a drill sergeant,
Right.
force exposure approach.
It's not throwing them in the deep end of the pool and saying, figure it out.
Right.
Actually, one of our words of the day, our jargon of the day earlier in the week was systematic desensitization.
Oh, there you go.
So,
exactly.
And we've been talking about that a little bit this week, and I had shared that my son, I didn't even realize it, was having a problem with tiled floors. We were getting tantrums when he would transition onto a tiled floor, and I was going, why is this happening? And finally,
Was he barefoot or with shoes?
No shoes.
Huh. He just didn't like the tiled floor.
Yeah, there was actually a grocery store that we would be in, and the one part of the grocery store had a very slick, shiny floor, and then there's a very rough transition onto some very tiled floor that's right by the dairy products, and he would snake out every time we went to the dairy products. And of course, I was thinking it's the dairy products. And I was thinking antecedents, well, we just went and looked at the octopus. Maybe there's something, and he found the octopus really reinforcing, but why are we having the problem in the dairy products? And I couldn't figure it out, Jonathan. And finally, we had the team come. They said, let's look at it. And of course, they walked in and saw what I, as a parent, didn't see, the floor changes.
Yeah. That's fine.
And then said, where else is he having this kind of reaction? And I thought, oh, when we leave Disneyland. And I always thought it was just that there was so much sensory going on in Disneyland, but when you get off the elevator and get to the parking structure, you have to walk down the tiled floor.
No kidding. That is really
And he was a mess. He would get completely disorganized and be a mess. And so they worked on him. It's a non-issue now, a non-issue.
And so do they do gradual exposure and positive reinforcement?
And positive reinforcement. We would go to the store and they would, and it didn't take very long at all, but they went very slowly. And and I, as a parent, would never have realized you could have, for a year, I just would have gone on with the tantrums in the store and been scratching my head.
Well, that's why our job is to be parents, not to treat our kids, That's why professionals exist.
Yes,
it's hard enough to just do what we need to do on a daily basis with our kids, let alone treat them,
But I think it's hard sometimes as a parent, you think, well, I should be able to figure that out. I should be able to know, and we can't.
That one's pretty esoteric. I have to say, a lot of good ABA folks would not have made that observation.
Really?
That's pretty...
because they got it the first second, and they were like,
they're doing a good job. Yeah. They're trained observers, but that is fairly...
Well, and honestly, I had taken notes on it too and said, I've looked at it this way, and I had tried this and that and the other thing and said, come and look at it because I have no idea. But, it got taken care of very quickly. And it's always the thing that I say, this is why you have to call somebody in. You can't have expectations that you have eyes in the back of your head or that you'll see it from a 360 perspective. But the systematic desensitization and dealing with it and reinforcing the behavior and going, it works. I mean, I saw that work with my son, but you're saying, it works.
It does, because there's some basic behavioral learning principles that apply to all of us and everything that we do, whether we like it or not. So even if we really wanted to continually be afraid of something, if someone exposed us to it really gradually and really repeatedly and didn't allow us to escape it when we were afraid, we would get used to it, like it or not. And that can actually work against you, too. If you get exposed to really great things too much, you can get used to those, too, and stop appreciating those things. It's just a fundamental way of how organisms adjust to their environment.
Okay, really important. And I was saying to you during the break that one of the things I certainly, and I've talked about it before on the show, that in the middle of therapy and everything that we were going through, I started having anxiety issues. And I thought, that's a terrible thing and not to be talked about, and a certain amount of shame that went with it. But I got help for it, and I got to the point where I couldn't leave the house, and that I was having anxiety at such a level. And then when I started talking about it, what parents overwhelmingly came back and said to me was that they also, were having anxiety issues. And then, of course, I thought, okay, so I'm not alone in this, and they felt like they weren't alone in it. But I got help too, and I actually think that me, being in a place where I said, okay, I need help with this, and getting the help helped my son with anxiety.
I'm sure.
So that my hope is, and I always watch him, I see that he has different weird things that his new thing is that he tells everybody he's afraid of heights. And he is reacting as though he's afraid of heights.
So take him rock climbing.
There you go. Good luck with that. So I don't know. And I'm afraid of heights, and I keep saying, okay, did he just start saying this because he heard me say it? But he is reacting as if he's afraid of heights. So that's going to be our new thing to take on. And I don't know who's going to do that. It won't be me, because I am afraid
You're
of
afraid
heights.
of heights. That's great.
So, no rock climbing in my future. But I do think it's important for us to acknowledge that everybody has some anxiety, right?
Absolutely, and it's very. I'm not sure exactly what the stats are for families of folks with autism, but I know that it's high, and it's higher than the average population. Of course, you're going to have anxiety. I mean, you get hit with this ton of bricks of your child has this pervasive developmental disorder, and probably the person that diagnosed your child told you something horrible, like that you're going to have to be in an institution, or he's never going to learn to talk, or he's never going to have a job, or he's never going to be able to say I love you. And so, of course, that's going to hit you like a ton of bricks. And how could that not produce anxiety, right? As a parent, I mean, to me, that seems like actually a normal response to that.
Yeah.
You know what I mean? That doesn't seem like an abnormal response.
Absolutely.
But nevertheless, it can be very debilitating, and parents, unfortunately, don't somehow those two pieces have not been connected. The ABA autism piece and the anxiety for parents piece have not been connected, and they need to be. I mean, that should be a standard part of triaging care for the family unit. Is okay, your kid's going to get intensive ABA, and you should be assessed for do you need some treatment for your anxiety too?
Absolutely.
Or some kind of support at least.
Absolutely, and Evelyn Gould's been coming in and talking to us about ACT,
that's right.
And that ACT isn't just for parents of children on the spectrum, but that more and more people are looking at that as a way of helping parents to deal with the emotions and the stress, which often balloon the anxiety into a place where it prevents you from being able to help your kid even.
That's right.
I'm grateful that I was clear enough to say this is preventing me from being able to. I started out I couldn't drive, and so I couldn't drive to clinic, but my husband was there to drive me to clinic. But eventually I went, this is not good.
Right.
I have to be able to show up for my kid, so I have to get help. I know other people who can't see that clearly, and that's really frightening.
Yeah, it's fairly common when you're in the middle of something. It's hard to see it.
Yeah.
I mean, that's almost a defining feature of disorders. Usually, is you can't really tell that you have it. Or you can't really tell that you're suffering from those challenges. So that's good that you're able to figure that out. And
I have a good husband who also pointed out and said, "You're having a problem.
Hey, go deal with this."
No, and he didn't say go deal with it. He said we need to deal with this, which was even better.
Yeah, it's really good.
I married a really great guy. Thank heaven. I don't know how I got so lucky, because I sure don't deserve him, but I'll keep him anyway.